Good evening, everyone. This is IMG Research Academy. Now we're, modifying our name to Global Research Initiative. It's a collection of physicians from all over the world, including the US, or physicians who are trying to get into residency training, or those in residency training already trying to get into fellowship or the next stage of their life. We come together to discuss first all things clinical research, and then yeah, clinical research is fine, but how do we also help the community and help ourselves to grow? So to help ourselves to grow, we need to become good doctors in residency training. Many of our members marched into residency this year, over 158 members from our group. It's an unprecedented number that we've seen. I think it's a result of hard work, God's grace, mentorship, continuous mentorship, and a lot of things are, excellency in application, excellency in results, and so many factors too numerous to mention that help people to get into medical residency in the US. For those in the medical line, they understand what I mean, how difficult it is. So when they march into residency, we don't just stop at you getting into residency. We also want to say, hey, now that you're in, how do you become better? How do you become better? Because we don't want you to just get in and say, hey, I'm marching into residency and that's a eureka. No. So we assembled expert opinions. These are people who have excelled in residency. Dr. Rafael Figueroa, Dr. Lepke Martinez, Dr. Letty Martinez, and Dr. Rafael Figueroa will work together. Excellent guys. Dr. Letty Martinez is my chief resident. Brilliant people, very down to earth. We're going to have 3 sessions of how to excel in residency. They don't only have excelled in residency, they practice also before. They're also foreign trained physicians. So they come in with a wealth of experience to advise young interns who have gathered here. And I believe we have over 60 of them or 40 of them listening to you guys on how they can excel. The topic today is how do you excel in residency? Lucky, how are you?
I'm doing good, my brother. Good afternoon, everybody. Congratulations to everyone who matched this year. God bless. Very happy for you guys. All the mothers also today. Happy Mother's Day.
Yeah, happy Mother's Day. Happy Mother's Day to my wifey, first of all. Let me just.
But I'm doing good, man. I can't complain.
Right. And to every other lady out there.
It could be better. It could be better.
It could be better. It could be better. It could be better.
But I'm happy, man. Thank you for having me here. And anything you guys need, feel more than welcome to ask.
Thank you for being with us through the ages. And Dr. Raf has also been part of our internal team. Even Dr. Lepke also has been, very huge support to me and to this community, even though they are behind the scenes doing their private thing. But every time I call on them, they are willing to come and share their time. 1 hour of a physician's time is gold. Dr. Raf, how are you doing? How's your day? You're muted. So it's going to be on mute, open mic, no formalities, no question and answer. We'll just, jump in there. Raf, how are you doing? Now I can hear you.
No, I'm good. I'm enjoying the day. It's the weekend. It's Mother's Day. It's a day to celebrate. So I can't complain.
Awesome. Let's jump in. Let's jump into the conversation. For audience, feel free to drop in your questions anytime. If you want to speak, you can raise your hand at any point in time. It's going to be like a semi-formal, informal session. Let's throw our mind back. Let me start with Lepke, or your intern days. Fears. Lepke is almost in his third year now. Couple of days, 30 days or less.
Oh man.
How did he feel? Let's take it from there.
So if actually for me, first year residency, it was overwhelming. I could say it was overwhelming because I did not have an idea. I had a little bit of an idea how it was gonna be for us. But when you put your foot in the hospital, everything changes for you. Your life, your time, your space, everything. And it's a little bit overwhelming. It can get sometimes overwhelming that you're going to be a little bit drained. But at the end of the day, it's a really nice and beautiful process because you're going to start learning what medicine is. We have an idea, actually. All of you have an idea, but you don't have the real idea as soon as you step into the hospital. And the hospital is you're gonna hit reality, and you're gonna be like, okay, this is here. Okay, let's go for it. You know what I mean? So I think just not only for me, but I think for you and for Ralphie and everybody, who are doing excellent at residency are great physicians. I think it was a little bit overwhelming and draining at the same time, but beautiful process, beautiful process. I can't complain. I can't complain.
Ralph, pick it up from there.
Well, first year to me, I think it was intimidating at first because, the difficult thing about when you first step into residency is you lack the expectations. You really don't know how to operate properly. You don't even know the difference between the OR and the restroom. You don't know where to walk. I could still remember I was trying to put Tylenol for a patient, and instead of oral, I gave a suppository. You know, but you're just trying. You're doing your best to try to figure out what to do and who to talk to, and
That's
you're
true.
lost. But I think the nice thing about residency is that is the to me, I trained in the Philippines, but I think in residency you have the ability to have the control over the patient. You have that independence in residency to make the patient feel better, and to work truly as a team. And I think as you progress through residency, that's where you feel like that bond between you and the rest of the team, whether it's the nurses, your fellow residents, and the attendings, it grows. So although it's scary and you feel lost in the jungle, you climb to the top eventually. We're still climbing, but we're getting there,
Yeah.
Let's go into some tips on adapting first few days. Lucky, I know you practiced in Puerto Rico before, and then you eventually transition.
Yeah.
So your scenario is almost similar to many people who are listening to you. Some of them have practiced before,
Yeah.
some haven't.
Yeah.
How was transitioning into?
So for me, to be honest, transition wasn't so bad. Let me explain you why. Actually, when I was practicing medicine in Puerto Rico, I was actually doing every 4 days, 24-hour shifts in the hospital. Okay, doing my intern year in Puerto Rico. So the transition to doing night shifts here, actually in the States, or things that I saw in Puerto Rico, were not so much different as over here. Okay, even though over here is another type of level of medicine, of course, I learned much more, but the transition for me wasn't so bad. Okay. Now the transition to start working with a whole team is totally different. Okay. Because remember, you have a hierarchy. You have the seniors, second years, you're the first year. So it's like Dr. Figueroa says, getting to know the time and adapting to everything. It was a little bit, I needed to switch it a little bit. My mentality had to be a little bit switched so I can get used to the process and starting to learn a different way about the medicine. But the transition for me wasn't so bad, actually. It wasn't so bad.
Awesome, awesome. Ralph, what about you? So what are the expectations for, and the same question we go to you, Lucky, for a new intern transitioning from an old practice
Mm-hmm.
to residency? What are the drop off habits, new habits? Let's hear from Ralph.
Okay.
Well, I think coming from a different place, or if you've trained abroad or something like that, I think you have to adapt, number one, to the culture of things. Although maybe you've been a neurosurgeon somewhere, or you've done appendectomies in your sleep blindfolded. Stepping into residency as an intern in the US, you have to humiliate yourself a bit and just give respect to those who are there already. Now,
Yep.
although maybe exactly, and maybe you even know more than your senior, or maybe you even know more than you're attending.
Mm-hmm.
The idea is to have the humility to at least listen and to follow. Now, you can, of course, give your suggestions because it's an open forum. Residency is an open forum. Everybody is willing to listen to your idea. But the idea is to give respect to those who have been there and who have been doing it longer than you in this setting. In wherever, in Alaska, in Antarctica, you may be the top cream of the crop, but here you're just like everybody else. So to me, my thing is, you give respect to everybody, and the respect will be given. So just to have a little bit of humility, although it's hard, it's not easy. It's not easy to say, yes, I'll do it, no problem. And if their way it is, you just try and give your 2 cents whenever you can. But of course, you have to just kind of adapt and have humility. That's my biggest tip,
I
to
agree.
transitioning.
What do
Agree.
you think about Ralph's response?
I agree 100%. The humility is something that has to be taken like 100%. So my advice to all of you: always stay humble. You know, yes sir, no sir. Learn, and just even though if you know there's something doing wrong, you can go through and go to the attending and be like, doc, boss, I think, can we try this? What do you think about this way? You know, and find a way to work as a team, you know, but always stay humble. The humility that Dr. Figueroa says, that's the most important thing to have, because you guys got to understand, you're going to be first year, and like he says, there's a second year, there's a third year, and you got to respect that hierarchy, and you got to find a way to work as a team and keep humble, so it can everything goes better through the day and the whole year and the whole process for you guys.
Brilliant, brilliant response. I think there's also something that comes with age, experience, and then trying to humble yourself. Two of them, they are not together. They don't come together. So there's a different mindset that should follow you when you come into residence. So you probably may have been the best obstetrician, whatever you are, and then you're the oldest person. For me, it happened to me, you know, and you kind of look at that first year or that second year, and he's a little bit younger and maybe let's say less experienced than you, and you want to speak over him. And after a while, it dawned on me, no, this is not the right thing to do.
Exactly. And for example, you know, Dr. Edwards, you're a great doctor. You have done medicine before coming to the States. And even you know their second years or third years that, for example, they don't know how to do a suture.
Right.
And you want to teach them, but at the same time, you got to keep humble because you don't want it to look bad. You know what I mean?
Right.
So you look the way to try to talk to them, try to talk to everybody. And at the same time, people from your first year, same year as you, teach them, help them. You know, we're all in the same boat. You know, we got to,
this new mindset, a new mindset that should come with you, an intern mindset. Ralph, shed a little more light on that.
You know, my idea always when you approach a new environment is you have to kind of observe how things are working. You know, whatever hospital you go to, whatever room you're in, you got to see, how everything operates first. And then from there, then you kind of figure out your place in things. You know, for example, the big thing as an intern is you carry the load of patients, you do the notes for a majority of the patients. And you'll see that a senior is sitting there, obviously supervising and doing everything like that. And they will say, you need to do all of these notes. And of course, it's going to be something that's going to be overwhelming. You know, it's no doubt that that's going to be an overwhelming task. But instead of being bogged down and thinking of it as a negative, you should take it as a positive. Okay, they think that this note thing is a big deal. Fantastic. I'm going to be great at doing notes, and I'm going to be finishing them faster than majority of them. So that when I finish faster, I'm going to be sitting like them, and they're going to be looking at me. Why is this guy sitting? Well, the work is done. So you try and adapt and you figure out and try and excel in something, make it look easy without, taking it as a negative. They give you too many patients, maybe more than what's regulated. Then you say, okay, no problem. We'll do it. And then that way, day after day, they're going to notice that, hey, whatever you give this guy or girl seems to be no problem.
Yeah.
If you have that attitude that it's no problem, let's keep it going.
Right, absolutely.
Then they'll observe and say, hey, you know what? Maybe this guy's not so bad,
Yeah. Let's moving away from mindset. There's also a component of residency, communication, that probably people should learn. Communicating with your fellow residents, communicating with the program director, communicating with nurses, there's a whole bunch of communication that determines your success. Let's take it from your intern days and now, and then what would you recommend, Lucky?
As my word would be, always try to be a team player. The communication is super important to be a good team player. If you have a good team, you're going to go directly to the championship. This is the way I see it. You got to start making those connections. Try to be a team player. Try to talk. Be honest with everybody. Try to win everybody in the hospital. Because at the end of the day, you got to understand, you're going to be here for a couple of years. And having that mentality of getting to know the nurses, getting to know the doctors, getting to know everybody in office, getting to know your teammates, your colleagues is super important. Why? Because once again, you need to be a team. Because if you're a good team, everything's gonna flow really good. You cannot have one person not communicating with you and communicating in another way, and you're going this way. So we're not gonna go to the same direction we want. So you need to be able to talk to your colleague, talk to your teammate, talk to everybody, so everybody goes to the same conclusion. Try to help the patient, make sure everything is okay, and keep on moving forward like we need to do.
Absolutely. One of the barriers to communication is usually cultural differences. And
Yep.
it's part of the reasons why I brought you guys, because you are very exposed to the Western world. Some of the people that we mentor are also trying to integrate into the Western world. So there's usually this barrier in communication, accent, um, confidence, not knowing what to say,
Trust.
um,
Also,
not
trust.
knowing how to say, feeling
Yeah.
that people are looking down on you
Yeah.
because you look a certain way or talk a certain way.
Yeah.
Raf, pick it up from there.
I
Overcoming this
think,
cultural barrier thing.
yeah, I think that's it's a very relevant topic to cover because I think culturally it depends where you come from. I think in when I studied in the Philippines, that's more of a Eastern Asian culture background that you kind of are more maybe quiet, more I would say you just do whatever the someone who's higher than you does. You're very quiet. You're just going to listen. I think in the Western approach, especially in the U.S., you have to carry yourself with confidence. You have to speak with a certain volume. The softer you speak, people will interpret maybe you don't know what you're doing or you lack confidence. So anything that you project, you should project with a decent amount of tone as well as volume. Now, sometimes there is a little bit of fake it till you make it. You may not know the certain diagnosis, but if you're able to deliver in a confident way, people will believe in you. I think the next kind of topic that you kind of have to address in communication is in medicine, there's undoubtedly a great deal of stress. So when you make a mistake, or whether you perceive someone being angry at you, maybe their tone is raised at you, you must just brush it off, you know, and approach with happiness. That's my biggest thing. Someone may, yell at you or something like that, but you cannot take that personally. That's just in the moment. You brush it off, and then you just say, "All right, no problem. We'll make it happen," and that's it. Because as soon as someone tries to challenge back, maybe someone who's younger telling someone who's older, you might have a 27-year-old chief resident telling you, who's maybe like me, I'm in my mid 30s, telling me, "Hey, what did you do that for?" Well, of course, I might think this young guy, he doesn't know what he's talking about. But I just think, oh, sure, no, that's, my wrong, and I respect that. And then you just move from there. So
Yeah.
the biggest thing is not to take anything too personally, and then just to move forward.
Like you shine more light on this communication thing because it brings a lot of chaos in the team.
It does. It does.
Someone just walks away from the room. He didn't even let anybody know where he's going. So he's not coming to work. No email, no courtesy, loss of professionalism. A lot of things that you've experienced as a chief resident, that, probably going to speak from there. It really dampens people's perspective of who you are. Let's go to specifics. And Ralph, you can feel free to chime in at anyone that you remember.
To be honest, it's gonna happen to all of you. All of you are gonna see that in residency. And the most thing that bothers me is actually that if those type of things happen, it's gonna affect the whole team. Just by someone to be doing that, it's gonna affect the whole team. Why? Because like Dr. Figueroa was saying, you're gonna be not trustworthy of the other people. The people are not gonna start trusting you. People are not gonna be confident in you. People are gonna be saying, "Oh, so what? This person did that." So it's gonna start bringing a lot of problems to the team. And you always need to be honest with your teammates, because at the end of the day, once again, we're whole one team. When everybody's doing inpatient, when you guys are gonna start doing inpatient, it's a whole team that's gonna be taking the fall for it. So always talk to everybody. Always say, hey, you have a problem. If the person gets mad and gets out of the room, give him a 5 minute, 10 minute, give him a breather, then go out. Hey, Dr. Edwards, everything okay, man? Yeah, are you sure, bro? You want to talk about it? No, yeah, okay, let's walk, man. What's going on, man? Oh, this. Okay, so let's figure it out, man. Let's do this. You think we can work it out with that? Perfect, Lepke. So let's go back to work, man. Let's just go through this day. Let's make it happen. Let's work on it. Okay. But it's really important because if not, I'm telling you guys, the team is going to be affected. You all need to be in the same page. If you're not on the same page, everything's going to start getting affected.
We've seen people who have, been put into probation in residency, eventually kicked out. So it's not even something we wish for people, but communication is one of the key points that people can't read your mind, right? You have to be able to speak up, put it in writing, put it in a text message. Not even text message. Text messages are also almost all the time misread.
Yep.
Be clear with your objective. Ralph, what pick it from there.
I think that's a very valid point. I think, when you don't respond well to a team and you walk away, it
Mm-hmm.
gives the impression that you don't care. And I think the most important thing in residency is that you move as a unit. That means in the more difficult rotations, whether it be inpatient or something like that, sometimes it's easier to take a sick day, but you must also think that because you're giving a sick day to yourself, you're giving a huge load to other people. And people remember that. One of the things that in my girlfriend's program, what they instill is something called feedback. So when a new team starts, a few days after the team has started, whether the interns have started, they ask their senior, "Hey, would you mind giving me some feedback? How am I doing? How's everything going?" Or, to the attending, "Hey, you mind giving me some feedback how I performed this week?" Because, if we don't ask how we're doing, we're going to keep doing the same thing, whether it's good or whether it's bad. If we're open to changing and learning a little bit, say, "Hey, Figueroa, you don't always ask the patient, if they have any family history of cancer, or they don't want to have a history of smoking. Figueroa, you always forget those things." If no one ever tells me that, I'm never going to change. You know what I mean?
Talking about
So
feedback, let me jump to Lecky because there's something he told me someday. Don't take it personally, Big Papi. Don't take it personal. It's a way we grow. I remember we're in clinic and he was talking about how our boss was. I was trying to tell him how my boss. Again, we're not speaking on behalf of our program or on behalf of anybody, and
Mm-hmm.
how sometimes he could be very firm on us just to make us grow. And there's something said, and that thing talked to me like, don't take it personal.
I remember that day. I told you, Poppy, just forget about it. Keep on doing what you know what
Yeah,
to
keep on doing what you're
do.
doing. Talk about feedback. Jump into how would you advise your intern self now to see feedback and receive feedback, and what impact does it make to your ultimate perspective in patient management, the way people see you, and the way your trajectory goes in residency?
Um, Easy. Make sure you guys ask questions. Make sure you guys ask. No question is a stupid question. If you want to get a good feedback, make sure you have the confidence to go to anyone and ask them. So asking anything, "Hey, how do I do this?" Or ask the nurse, "Hey, how do I do this?" Or, "Doctor, I forgot how to do this. Can you please explain this to me?" It's not gonna make you look stupid or anything like that. It's gonna give you a good feedback. Why? Because it looks the interest of what you want to learn, what you want to be. Okay. And at the end of the day, you want to be the best doctor available, or the best family medicine or internal medicine or neurosurgeon available. So the only way you're going to do is ask questions, feel comfortable to do it. Don't feel bad. So you always get a good feedback. And don't feel bad if they tell you, "Hey, I think you should do this better." Don't feel bad. "Oh, you think so? Okay, sit down, a couple minutes. How can with this feedback, how can I change this so I can be a better physician later on?" So everybody has a good feedback. Just make sure you feel comfortable in asking and trying to have an open mindset to change things so you can be better later on.
Is there any area, Ralph, that Lepke has not mentioned, talked about in the feedback thing that you want to fill up?
Well, no, I think the only thing is, when you're asking for feedback or where you're asking, how did I did or what should I do, because inevitably we're going to see a patient where we just don't know exactly how to move. I think the one warning I would say is you need to at least give an effort and to see at least your possible plan, right? You don't want to ask your attending, hey, what do I do about this guy with chest pain? You should already have in your pocket, well, I've already looked on what kind of imaging I can order. I can already look on what kind of medication I can order. Based on these things, the algorithm tells me I should do this. In your opinion, doctor, what do you think? So always come prepared. Don't come blind and say, hey, what do I do? Or hey, what are we going to do, guys? You know what I mean? You should have at least something prepared and then go from there because it shows effort. It's okay not to know, but if you come in blind saying, guys, what's going on? This guy's dying. We better, it's good to be professional and be prepared, even if we don't know everything, right?
It's been about 15 or 20 minutes of undiluted how to survive in residency. Ralph and Lepke, I truly appreciate you guys. We're gonna go a little bit with your permission. I know I told you guys 30 minutes. It's 7:31, but permit me to push it a little bit down to like 20 more minutes.
Yeah.
Ish, because there's a lot. It's a lot. I never knew this conversation would be this interesting. And then
Sure.
more and more people are joining. We are having well over 70 people listening. That's like a hall full of people. And we're going to share this, this video on social media, making impact to more than 1 million people who are going to come across it in their lifetime. Time management is something that is so critical as a resident. A lot of things are thrown at you at the same time, multiple things. You're writing notes, talking to case management, you're going to present to attending, you're reviewing this, you're waking up in the morning by 5 or by 4, depending on how your program is structured. You're closing late by 7. 1,000,001 things are thrown at you. Time management. Looking back at your internship, what were the challenges and how would you advise someone moving forward to better prepare for what is ahead in residency?
Honestly, to be honest, I'm going to be honest with everybody here. First year of residency, intern year, is like you're going to have less time to do stuff, okay? It's going to be really, really difficult to spend time with your family. I know it's going to be hard. Spend time with your family, go to the gym, do things you like, but you have a responsibility. First year, you're going to have a lot on your plate, okay? But everything goes by quickly, okay? But just make sure that time that you have in the hospital, like Dr. Figueroa said, put a good effort on it, okay? Because you're going to be doing a lot of notes. You're going to be talking to a lot of seniors. You're going to be presenting a lot. You're going to be moving up and down a lot. But at the end of the day, it's for the best for everyone to learn and try to be a better physician later on, okay? So everything is a process. You're going to need to put the effort to learn everything you're going to learn, the basics for everything that you're going to learn to try to be a better physician and try to be a better second year senior for the first interns that are going to come in. So you got to be able to put the effort, learn, even though you're going to have little time to do a lot of stuff because you're going to be most of the time inside the hospital. Dr. Edwards knows that sometimes we used to go at 5 a.m. in Figueroa. Rafi, December, we used to go 4:35 a.m. and we didn't go out until 10, 11 p.m. at night. Okay, it's the first year. It's part of the process. Don't think you're gonna be the only people who are passing through that. A lot of people are passing through that on the first year. Okay, so it's just a process. Just put the effort, learn, because you're gonna see then the difference later on.
What I usually say is that, and I like this conversation. Residency is actually a training, not a place to raise family, not a place to be comfortable, not a place to look for comfort. It's a training. It's just a short time, 36 months or thereabout. Put in all the best you can. You're not going to have this training ever again in your life. And maximize the time. If you know that you're slow, come super early or you preview your patients a day before so that you'll be ready, moving forward, and then prepare for exigencies. And like Lepke said, sometimes you're gonna fall behind. It's okay. It's okay to fall behind. But with time, everyday practice, you begin to become more efficient and efficient and efficient. Rafi, what do you say?
Well, I think about it like this. Residency, like Dr. Martinez said, is you don't have time. And that's true. You know why? Because when you're not in residency, you have all the time in the world. I could go get ice cream. I could go to the gym. I was sitting on the beach. But I'm happy I don't have the time in residency because the reverse was I had too much free time. Now, talking about time, I think the most important thing is when you first start, you got to identify what you're slow at. If you don't know what you're slow at, then you don't know how to get better. Everyone's got a wife, a partner, maybe a pet fish at home that's waiting for them when they finish the day. You got to figure out, hey, I'm slow at notes. I gotta work on this thing. I gotta work on typing a little bit faster. I gotta stop talking about the baseball game last night. And like me, look, I'm slow on some things, so I don't eat. That's not a great idea.
Yeah.
But look, I like to get
Yeah.
the work done, and
That,
then you know what? I'll eat like a king when I'm out.
I don't know
You
how
know,
I don't know how Rafi does that, man. So,
so you have to gauge your day. What's the most important thing? Your patient is number one.
mhm.
If there's something imminent with the patient, forget everything else. Forget about talking to another patient's family. If there's a critical patient, it's just common sense to do that. Obviously it's nice to have a nice small talk with your co-residents and everything like that, but that comes at the expense of, well, now you got 5 notes, you go home to your wife, you can't talk to your wife, you got to go sit in the bathroom typing on the toilet. So you have to make some sacrifice there. Your sacrifice of a meal at work might mean that maybe you'll have a meal with your wife when you get back. So really it's just you'll never have the full time, like Dr. Edwards said, you'll never be able to do everything. You're going to fall behind, but it's just knowing what you need to sacrifice that day. For me, I'll sacrifice food, no problem. For others, maybe they're going to sacrifice, something else. Maybe they're going to sacrifice that dinner with their wife and they'll make it up to her on the weekend or something.
Uh,
So, you just got to make that choice on what to sacrifice. There's no such thing as a balanced life in
no,
residency.
it's not.
If you want a balanced life, go play checkers on the beach and forget medicine.
It's happening. First year, nah, it's not happening, man. There's no way.
Yeah, talking about same time, well, let's stay there. So residency is also a place to actively study,
Yeah.
but a lot of things are thrown at you at the same time. How do you guys maximize improving in medical knowledge and balancing time? Because you come in the morning, 8 to 9 patients are thrown at you, and then you're running, your attending is coming by 10, depending on how your program is structured, because different people march in different programs with different structures. But almost every residency in the US runs the same thing. Ward round, um, attending discussion, presentation, noon conferences, clinic. Almost the system in the US is almost universal. So how do you incorporate growth in knowledge and then um, in 10 years tax and balancing time?
For me, to be honest, it was at least waking an hour before going to the hospital. For example, I had to be in the hospital at 5 a.m. At 3:30, I was up at least an hour reading about subjects that we talked about the rounds the day before, because I knew the attending wasn't going to come in and, like we say, kill us with the questions. So I was reading before going to the hospital because I was saying, knowledge-wise, I'm learning about it, first of all. And second of all, if the attending was going to ask something, I was ready. Okay. So that helped me actually make this habit of studying when there were cases that I did not know much about the information or something. What I used to do is wake up at least 1 hour earlier, go into the hospital, read about it, review them, because I was ready for the day. That's usually my plan. That was me.
Rafi.
Yeah, I think it's inevitably very difficult to find the time to really sit down at a desk and to be honest, to study. I think in residency, to me, it's sheer exposure. So it means that you're being exposed to multiple cases, and it's up to you really to kind of absorb that knowledge. I mean, for me, it was maybe forming a personal connection with the patients to kind of, because if you remember something particular about a patient. Um, and you can tie that in, you'll remember it more. I remember a patient that I had. He had a knee replacement, knee arthroplasty. I remember the guy because he was a short little guy, big neck. I thought, wow, this guy maybe has a genetic condition. And then right after his arthroplasty, the guy coded. Um, And that case, it remained in my head because I built that personal relationship with the patient. So I continued to study. So to me, the things that I remember are things that I connect to. So in order to study, you try to balance a little bit of rapport because it's just like your best friend. It's easy to talk to your best friend, but in a patient, it's hard to connect, right? So you try and form a connection with them, then you're going to learn about their COPD. Then you're going to learn how to manage your COPD. I think when you see patients constantly and you form a relationship with them, I think it's easier to remember their case, and then you're going to remember their management. Then you're going to remember their complications. I think studying and opening the book in residency when you're tired, you're only sleeping 3 hours a day, it's possible. It's possible, but it becomes very difficult. So if you form a personal connection, I think you learn a little bit easier. That's my advice.
Thank you so much, guys. I remember something my program director told me when I started. For every patient that you see, you have not done a complete job on the patient. That's what he said. So go home and then look at what area did I miss so that when I see this similar situation or scenario again, I'll be able to fill up the blanks. And it's okay not to know. As an intern, it's very okay not to know. But make sure that for every diabetes that you see, you go back and say, I gave 10 milligrams of 10 units of insulin. Was that the right thing? Was that what the guidelines said? And then you look it up when you get home. You may not look up all your 15 patient panel. You probably look up one or two or three that you're connected to, and then you keep improving. And again, these cases are repeated. You're going to see pneumonia over and over and over and over. You're going to see hypertension, hypertensive emergencies over and over and over and over. So if you keep adding one little dot to the hypertension that you saw today or to the stroke that you saw today, tomorrow you add another dot, next week you add another dot. By the time you accumulate all the dots that you're going to add, it forms a line. Brilliant advices. I call them my friends and my pals. Let's move into something very lighter. Housing, stipends, salary. These things are not enough. Like
Oh,
how
man.
where should a typical intern live? I know I live like 2 hours away from my residency, but from my perspective now, it's not the best. Not the best. And then they pay you the stipends, 1,000, whatever X amount, depending on your program. You don't have enough money. And then you have bills to pay. Let's go lighter. Let's start from accommodation, how a typical intern should look at these things.
Uh, so for me, I actually live without traffic in Miami, guys. 7 minutes from the hospital without traffic. But when I get traffic, it's 20 plus. Okay. So for me, I was just trying to get a place close to the hospital, like I say in my bubble, so I can have a good motion to anywhere I was going. Now, area, it's a little bit expensive for us, all of us, including Dr. Edwards, Dr. Figueroa. The stipend we get for the check, it's not too much. The check that you guys are going to be getting is not going to be too much also. So in my case, for me, it wasn't so bad because since I was working in Puerto Rico as a doctor, I had time to save a little bit of money, which helped me move to the States and help me with the process I'm going through right now. Okay. But it's not going to be the same case for everybody. For in my case, it was just like that. But at the end of the day, depending what fits for every one of you guys makes it more easy. I know Dr. Edwards lives a little bit far. Dr. Figueroa lives really far from the hospital,
Yeah,
and they make an effort to do it, and they
yeah.
do. So it's not easy, but you can do it. So everybody's his story is totally different. I want to see what Rafi says.
Ralph, what do you say?
For me, I live far. I live far from every single part of the hospital, at least 2 hours from everywhere. At first I thought, what, this is probably not the best idea because I'm going to have to wake up early. I'm going to have to go. I'm going to be tired. But, to me, it's a blessing because number one, the commute, I use it either to study, I'll listen to a podcast or something like that. Or option two, I'll talk to people that I love. I'll talk to my brother, my mom. I'll talk to my girlfriend. So in that aspect, it's a blessing. The other thing is for me, when I leave the hospital, I don't like to think about work. And the nice thing about living 2 hours away, you don't think about it. You're so far, you feel like you're on vacation. I see people in the beach right now, and they're just celebrating. I saw a big yacht jump by, and I thought, oh, it must be Edwards, you know? But you know,
Bring
but
Bobby Pastor.
it
Someday,
depends on
someday, someday,
everybody.
someday.
You know, if you're talking about time management, like we were talking before, I think definitely first year, you know, the recommendation is live close to the hospital, because once you finish your work, you'll be able to maximize your time to either work out, spend time with your loved ones, those kinds of things. Obviously, if things are a bit cheaper, a little bit further away, just,
Of
you
course.
know, if it works money wise, then it makes sense. I think the other option is that you guys should think, of course, if there's time, if there's not time, I think it's to pick up some kind of skill for you to earn some money when you do have free time.
Yeah.
Obviously, moonlighting is an option, but for me, even when I was in college or something, I learned to make a little money in the markets. You know, if I could, make a little money to help supplement my income, it gives me a little bit more freedom, whether that's, delivering DoorDash, doing some kind of medical consulting on the
Yeah,
side.
all
It's always,
program. Yeah, program specific, because some programs don't give such leeways for residents. But I understand what you're saying. Absolutely.
yeah,
Yeah. What now that we're trying to not now, we're about to wrap up because I've kept you guys beyond my contract time. Let's do some summary of what we've said, and then we're going to open the mic for people to ask questions. We're not going to take questions beyond 10 minutes because I respect their time. But before then, so in summary, Lepi, what separates an average resident from an excellent resident from your experience? You worked with a lot of residents, you're the chief resident, and then you've also had experience back home. What would you say separates an average resident from an excellent one?
From my point of view, I'm gonna be really quick with it. I really love what I do, and I take something from everyone. First year, second year, third years. I learned something, for example, from Dr. Edwards. I take something from Dr. Figueroa. I take something from everyone and try to be the best I can. My opinion about it is embrace the process. I think Dr. Covey and Dr. Figueroa are gonna agree with me. Embrace it. You're gonna only have 3, 4, 5 years of it. Make sure you embrace it, learn about it, enjoy the process, stay humble, learn about everybody, have a good communication with your team. Because at the end of the day, when you guys are done, everybody's gonna be alone outside, and we just gotta try to be the best physician available. Okay, so embrace the process, enjoy the process, and love to do what you do.
Rafi, success in
yeah,
residency, same
yeah. I think
thought process. Yeah.
Yeah, I think success in residency, I think, the fundamental thing is I think you have to have a clear direction of where you're going to go after residency and what your plan is after in order to succeed in residency. So what does that mean? I mean, that means if you're looking for fellowship, that from day one, you already have a plan set up on how you're going to get into fellowship. Or your route two is, hey, I'm going to form a business when I finish. So I'm going to, gear myself towards that way. I think the other thing is, I'm going to reiterate back is to have the humility to learn from others. Like Dr. Martinez said, everyone in the hospital has something to teach you, whether it's the janitor, whether it's the nurse, whether it's the chief resident, or even the guy sitting in the corner. You're going to learn from everybody. And I think if you're open to it, I think you'll succeed. I think the next thing is just to say yes to almost everything,
Mhm.
obviously, within reason. If you keep saying yes, eventually you'll learn. They're going to ask you, hey, do you feel comfortable doing this procedure? Yes, sure. Even if you don't know, you'll learn. And that will help you grow. The idea is to feel uncomfortable so eventually you become comfortable. And to me, that's the only way to succeed.
Thank you, guys. Amazing conversation. I particularly learned from this. Maybe I set this up for myself so that I could get more knowledge. It's been a pleasure talking with you guys. We're going to do an open mic session. Everyone, if you want to speak, just feel free speaking. Ask your question if you want to weigh in 1 or 2 words. If you don't have a question, you want to acknowledge them for coming. Whatever you want to say. Again, we don't share their information. We don't encourage them to respond to anyone privately because of their private time, but they could be reachable through me to the group. And then if you're in the group, we can also send 1 or 2 things. But they're very pretty busy guys. I bet you I prioritize the things I send to them. If it's not something that's going to help your growth process, I'm not going to forward it to them. So questions and questions and questions. And no question is stupid. No question is useless. Anyone have any question? If you raised your hand, just know that I can't see you because there's a lot of people in the group. Just open your mic and just say hello and ask your question.
Well, my name is Ketura. I just want to thank Dr. Lekpi, Dr. Rab, and the coordinator of this group. This is my first time here. I'm very grateful. Thank you for your advice. Thank you for your words of wisdom, and I really learned a lot. I'm a PGY1. Thank you so much.
Wow, you're welcome.
Congratulations. Good for
Do you
you.
mind telling us where you are? PGY1, New York.
Yes, I mean, I'm a family medicine resident in Mississippi.
Yeah, welcome to the family of, we're all family medicine people.
Oh yeah. Oh nice. Oh nice. So nice to know.
Yeah.
Nice to meet you all. Thank you.
Natalie, your hand is raised up. You can ask your question.
Okay. For those of us who have been away from clinical medicine for a while, like, are there any books you recommend? Maybe history taking and all of that that can just help us, brush up on some of the common conditions we see in the clinic or in the hospital.
Yeah, let me pick it up from there, and I'll give Rafa. There's a lot of tons of materials that I have for an intern. I'm going to share them, or you reach out to me. Templates for notes, templates for shorthand books for medicine. If you're in medicine, I'm in family medicine, so I may not be the best person to share shorthand book for internal medicine, but I have short diagnosis, quick diagnosis, and then again. I say this over and over again, it's an evolving field. AI is beginning to evolve. Open evidence, they didn't pay me for this. And even ChatGPT sometimes can help you make these new tools up to date for us in medicine total, whether you are in internal medicine or family medicine, has been a very resourceful material. There's some specific family medicine books, AFP, articles that we read. And then for those internal medicine, med-peds, surgery, I know people match in different places. We're going to bring in experts on those because remember I said this is 3 series talk. This is all family medicine people are giving our talk. Next week, new set of people are going to come, and the other week, we're going to do it in 3 weeks of session. So that's what I will say in our contribution. I'm going to share these resources whenever you reach out to me. That's going to help you. But again, it's also program specific because there's a way that my program wants you to structure our notes. Your program may want it differently, or you're attending, or it may differ from attending to attending. There's a way Dr. Diaz wants his notes to be, and there's a way Dr. XYZ wants their note to be. And it all varies. But there's a median team usually. If you use that median team, it's going to help you a lot. I don't know, Ralph and Lepke, if you want to chime in on that. Materials that will help.
So actually, I will agree with everything you say. So when I came to the hospital, I actually saw the templates that we actually were using in the hospital. I started to get to know and study all of them. And every attending is different. But actually, in hospital setting, we're going to have our own template to start studying. There's some actually pocket books that I've seen in Amazon. I used to use them actually when I was in Puerto Rico. I don't remember the name right now. I'm so sorry about it. It's a really small pocketbook. It helped me also a lot inside the hospital setting. So I would really recommend that also for you guys. But it all depends. The hospital, it all depends. The program, it all depends. The attending, everybody wants the notes different and everything like that. But in hospital settings, there's some good pocketbooks that you can study, which will help you through the whole process actually of your intern year.
Dr. Cosmos, I see your hand up. You can unmute yourself. Remember, your mute's open mic session. So just open your mic and speak.
Yeah, I just want to say a few words. One, I'm very excited to be here. And I want to wish the women in this platform a very happy Mother's Day. Yeah, I want to say that my first mock interview for this program was anchored by Dr. Raf. So it's my pleasure to see him again in this platform. Dr. Raf, thank you so much. That was a very great.
Dr. Raf, So let me give you a little background on what's going on. Dr. Cosmos marched. He graduated in 1994.
Uh-huh.
Very rare to see people who graduated 31 years ago marching into residency.
Wow.
We organized some
where did he match?
Support, consulting support for Dr. Cosmos. And, we attacked it from every angle. And Raf was one of the people that, held his mock interview.
Yes, congratulations, Dr. Cosmos. I remember you, and I knew that you would do great things and you will continue to succeed. So congratulations again. You truly deserve it.
Thank you so much, Dr. Raf and Dr. Lecky. Thank you so much. Listening to you guys this evening, including Dr. Ed, it has been an eye-opener and has actually prepared me better for the task ahead. If not, I would have taken a lot of things for granted. But having listened to you, I think I'm much better prepared to face the task ahead. Thank you so much.
Congratulations.
Guys, we're letting you go if there's no other. Yeah, go ahead. Sorry, let you go ahead.
Congratulations. Now, for me, it's an honor and a privilege, sir. So congratulations, sir.
Thank you. Thank you so much. It's my pleasure.
He's actually a German-trained orthopedic surgeon. He went to do his orthopedic fellowship in Germany, and then part of his orthopedic fellowship in Germany. And it's been a tough process bringing him to get into residency. And I think God did it. That's what I'm going to say. God positioned men along his path, and then we, all running around, and God did it. Final words. If there's no other questions, I would like to let my friends go. Final words from anybody, any question, feel free. It's an open house, no judgments, no wrong or right. Anyone?
Yes, sir.
Yeah, go
Thank
ahead.
you so much. Thank you for the opportunity to be here. It's been very informative. I just wanted to ask, so the other time, Dr.
You mind introducing yourself a little bit, where you are, because people are calling in from everywhere around the world.
Is it better now?
Yeah.
Okay.
Just a little introduction of who you are, where you're coming from.
Oh, yes. Well, my name is Bukumi Oluwole. A residence applicant at this time. So I think it was Dr. Lepke that was talking earlier about saying, okay, I'm comfortable doing this, even if you're not so good at it. So I was thinking, what's the threshold for mistakes for an intern?
Oh.
And then, yes, is a mistake on you? Would it be counted in your name or in that of the attending? So that's the question I had. Thank you.
That's a great question, actually. Yeah,
so,
let's pick it up from there.
Okay.
So
actually, first of all, Doc, we all make mistakes. Okay. Even though, like Dr. Figueroa says, always try to feel comfortable with yourself. And yes, I'm going for it. Let's do it. We all do mistakes. Okay. But at the end of the day, if it's a mistake that you really, for example, did it, hey, I did it. So go directly first to your attending and say, boss, this is what happened. I did this. How can I fix it? Okay. Just make sure. If you did something, make sure you accept what you did, okay? But at the same time, if it's something that really, really you do not understand or do not know, before making a choice, always you have a senior, you have two seniors on top of you, okay? So always go first to them, talk to them, and they're gonna help you with the process. And if they do not know, next chain of command, we go to the attending, okay? At the same time. So don't feel bad if you make a mistake. We all do mistake. We're here at the same to learn about the whole process. And that's what's going to make you better later on. Okay. So don't feel bad. But at the same time, if you don't know something, like I said, ask your seniors. The seniors are going to tell you what to do and you do it. If not, we got another chain of command. We go to the attending and let the attending know. Okay. So don't feel bad if you're going to make a mistake. It happens to all of us. We've all done it. We're not perfect. So don't feel bad.
Rafi, you want to chime in on that?
Yeah, I think, mistakes are acceptable, like Dr. Martinez mentioned, but I think the idea is, we've all taken an oath to do no harm. So that means that, we're not going to be negligent in anything that we do. We don't want to say something that we haven't researched on our own. And if we don't feel comfortable doing something, like I said, we sometimes have to push ourselves. But of course, that depends on the situation. You're not going to say, hey, I feel you've never done a central line. And you say, no, you tell the attending, no, I can do it. And then you let them walk away. No, you say, hey, I haven't done a central line. I'm willing to learn how to do one under guidance. And then you proceed forward. You always acknowledge your shortcomings and then try to improve upon them. And mistakes happen, but as a team, the communication is the most important thing. So clearly communicate at what level you feel comfortable with, and then just move from there.
Absolutely. I'm not even going to add a thing. Just a little, add and just remember that you're on supervision, like, my two friends have said, Lepke and Raphael. Your residency is a supervised environment. Yeah, you can do something, but your senior has to supervise you. And then your attendants have to supervise you. If you're very super comfortable doing it, also it's a supervised environment. Like you said initially, humble yourself, because there might be a dimension that that you think and because they've been in that environment, they've learned the tools in that environment, and they probably do it a lot better. I'll give you a typical example. I've done over 1,000 suturing, whatever suturing you're going to mention, intraperitoneum, extraperitoneum, different types of suturing. But every time I spend time with my program director, watching how he sutures a patient, I learned something different. Initially, I wanted to show off, hey, I know how to do this, but with time, I learned to humble myself. Like, hey, boss, let me see how you do this. And every time he puts his bites on his needle, I'm like, wow, this is different from what I used to know. And, it makes you a better person. You're a student, you're going to learn. And eventually 3 years, 36 months, and you shine. Thank you, guys. No other question. If there is any other one, we'll try to let them go. In summary, this is part 1 of how to become an excellent resident. You 158 people from this group have marched into residency. We're very happy for you, and absolute blessing. We want you to remain torchbearers, not only of this academy, but of yourself, your family, and make impact in this country that we are. If you're in Canada, if you're in US, make impact. This is now what I say, your new home, like your new home. Be a patient advocate, be a great team player, know that you're on a journey to grow. Final words from Lekki, final words from Rafi, and we call it a day.
So from my point of view, thank you guys for having me here. Thank you, Dr. Edwards. Rafi, always a pleasure. It's a pleasure, honor, privilege working with you guys. Congratulations to every single one of you. Enjoy the process, embrace the process, learn everything you can learn, and God bless you all. Thank you, guys.
Thank you. Rafi.
Yes, well, thank you. Thank you all of you, for the time and everything like that. Congratulations to all of you. You've just broken through one of the most difficult barriers that you could hit in life. You've just opened the door to an endless amount of possibilities. Getting into residency is, to me, one of the biggest steps that you've just opened, and now all these doors are going to open for you. So thank you, Dr. Edwards. Thank you, Dr. Lepke, for the opportunity to spend together. It's always a pleasure working with all of you. And I think each and every one of you are going to do fantastic. Just be positive, be open, and you guys will all succeed in all of your individual fields. And we can only thank God for giving us the opportunity.
So I like doing my screenshot before I go. It's something I like to do. Thank you, guys. And
thank you.
See you anytime. Please keep your door open. I'll be calling very shortly. For any other session in the future or whatever. I know you guys are busy. Have a wonderful day.
Love you guys. Take care, guys.
I love you too.